Good morning from WKYT News. I'm Bill Bryant. We welcome you to Kentucky Newsmakers. Later, we'll hear about a strong Kentucky-based effort to help those dealing with the deadly flooding from what was Hurricane Helene. That's coming up shortly. But first, the U.S. election is now less than a month away as we're on the air. This week, the vice presidential debate seems to be the last major forum of the American election. In Kentucky, voters will face two proposed amendments to the state constitution. One is about who is allowed to vote, the other on what the legislature is allowed to do with tax dollars for education. Kentuckians will also elect members of Congress and the state legislature. In central Kentucky, there's a race for a seat on the Kentucky Supreme Court, and many localities will decide whether to allow medical marijuana to be dispensed or processed in their community. Joining us now is Kentucky's most quoted political scientist, UK professor Dr. Stephen Voss. Thanks for coming in, Professor. Great to see you.
Thanks for having me, Bill.
So the election now is less than a month away. We all keep waiting for a national trend to emerge. Those polls keep being very tight. Would you agree the only trend we're seeing right now is that it's close?
It is close. There has been change, though. The paths that Kamala Harris has to the White House have broadened compared to when Joe Biden was the nominee. Donald Trump's path has shrunk. He's got to win most of the states up for grabs. If you're a Republican, you're not feeling too good about the change. If you're a Democrat, you're feeling better.
You teach voter behavior. How many voters are persuadable at this point?
We still have persuadable voters. What we don't have is a lot of reachable voters. I mean, these are not the sorts of people who sit around and watch vice presidential debates or pay attention when the ads come on. They get up and go get a snack. These are really hard voters to reach, hard to persuade because you can't reach them.
A lot of Kentucky voters may wonder why are they sort of left out of the action. You know, as you mentioned, there are those battleground states, and it's 5 or 6 states that get all of the visits and all of the ads are seen there. Donald Trump got roughly 62% of the vote in winning in 2016 in Kentucky, and then in his losing race in 2020. Does the fact that the state does not appear to be competitive answer why Kentucky gets very little attention?
Sure. The state's not up for grabs. We don't even have lower-level congressional races that are packed with drama such that the presidential campaigns would want to show up here to try to influence races below the ticket. We're pretty much settled in most of our elections. We're not worth the investment. And you know, Kentuckians may feel bad about being ignored, but you'd rather be watching our TV than watching Pennsylvania's television stations right now because they're getting saturated with political advertising. Yes, that's right. They're getting sick of it.
They can't find out about the sales at the local grocery, right?
What's the price of meat? I don't know. There's that piece of meat.
Too much
campaigning again.
What are the key issues out there, you think, in the presidential race? We see the economy, immigration. We know that abortion has all three of those. Are those probably the 3 top issues?
The economy is almost always the top issue. Now, it varies a little bit how we're thinking about the economy. Is it unemployment? Is it inflation? These days, prices are a bigger problem, and unemployment, obviously not much of one, relatively speaking. That does help the Republicans, because usually when voters are grumpy at inflation, they get the sense that the party of the right, the Conservative Party, tends to be more of a warrior against inflation, whereas the party of the left tends to be more of a warrior against unemployment. So the fact they're thinking prices is good for the GOP.
Immigration has been a major issue as well.
For a while, we had a real leftward swing in our immigration attitudes, and that helped the Democrats. But there's been a real backlash, especially against undocumented migration. It's yet another issue that's helping the Republicans. What we have is a damaged Republican candidate, Donald Trump, against a bunch of issues that help the Republican Party, and that's what the voters are having to seesaw between.
We have seen that the abortion issue has been a major issue in this campaign, as it has been the last couple of years in some of these races. Hadley Duvall from Kentucky has been prominent in some ads. We know that Governor Beshear also has made a lot of television appearances, and that has been a focus area for him when he's been talking.
Yeah, abortion has been just the gift that keeps on giving for the Democratic Party. It's especially helping them with suburban women and women in around the cities, exurbs. It also helps some with some male voters who don't think of themselves as particularly progressive, but they are pro-choice. The question when we talk about balancing is what's going on with men of color, African American men, Latino men, who, in the polls at least, are acting more inclined to vote for Donald Trump than they typically have been willing to vote for Republicans. If they stick to what they're saying in the polls, it counterbalances this backlash among women and feminist men voters that abortion has set off.
All right, we'll keep watching the presidential race. There are, as you noted, U.S. House races across the country. Every 2 years, you elect the entire House. And in the 6th District here in central Kentucky, and it was easily carried by Democratic Governor Andy Beshear last year in the fall. Does it appear to you that Republican Congressman Andy Barr, though, has a major advantage over his Democratic challenger, Randy Cravens?
The 6th District leaned heavily Republican before our last round of redistricting. It got marginally even more Republican afterward. It's true Beshear was able to win among those voters, but so were Republican candidates for other offices. It's a district that could be up for play. So far, Cravens doesn't seem to have the level of backing that would be needed to really threaten Andy Barr. But, there's always a surprise or two in every congressional election.
Do you think that Democratic candidates out there try to figure out what secret sauce it is that Andy Beshear has, both in state and out of state, right? I mean, he can be mystifying to some.
I think the Democrats took some pages out of Andy Beshear's playbook when they hosted their Democratic National Convention. I do think there's been an attempt to figure out his magic. The problem is imitating it when you don't have the funding, right? And trying to imitate what Andy Beshear did when you're not the top of the ticket, you don't have the money and attention. That's the secret sauce, is having enough money to mount a campaign.
We did see a surge in new voter registrations heading into the presidential election. In fact, we'll note that the registration deadline is Monday, so you need to get registered if you are not and you intend to vote by the end of business on Monday. But we keep seeing the trend, more Kentuckians registering as independents. That is now topped 11% of the electorate. Do people feel constrained by the two-party system, or at least some? I know that this is mainly the young voters that are going independent.
People have been complaining about the two-party system for as long as we've had a record of people's opinions toward the two-party system, but the rules under which we operate really favor that. And Kentucky is a great example. We have a closed primary. If you want to vote to help decide who the party nominees are, you need to be a member of those parties. The fact these folks are willing to register as independent when they're taking power away from themselves, when they're taking themselves out of the first stage of the game, is a pretty remarkable statement of how unhappy they are with the two choices they normally face.
They're giving up their primary vote.
They are, to declare that they don't want to be members of either of those clubs.
Do you see that reaching critical mass at some point where it may be that, that they are allowed, independents can vote in Republican or Democratic primaries?
The fact that these folks don't have loyalty to the parties does create a source of instability. They're willing to consider candidates from outside, inexperienced candidates and the like. But trying to stitch together all those independents into something new is hard to impossible, because those independents don't all want the same things at all. They'd have a lot harder time unifying than either the Republican voters or the Democratic voters do.
Of course, they do have to pay for the primaries, which is a gift to the parties, essentially, from the state, right?
Well, that's our system. Some states don't allow the parties to control the structuring of the votes. My home state of Louisiana, for the longest time, had a so-called jungle primary, where you could have a D or an R by your name on the ballot to help voters figure out what you were, but that did not structure the outcome. The top two vote getters usually would go into a runoff, and if that's two Ds, two Rs, an independent, it didn't matter.
We have here in Kentucky two proposed constitutional amendments on the ballot. The one getting the most attention is Amendment 2, which would allow the legislature to divert tax dollars to private or charter schools at their discretion if they were to pass. Who's winning the messaging on that amendment, or do we know? Usually
with school choice, the advantage is with the people trying to stop it, because they're teachers, educated people, often respected people in every county, and heavily from the teacher's voice you hear criticism of school choice, whereas usually the support for school choice mostly relies on money that comes in from outside. But Kentucky is right now what usually we see when there's a battle over school choice. It's a proxy war for two national forces, teachers unions and progressives against conservatives who want more of a market-based educational system.
There's been some talk about who can say what about the amendments, and the state attorney general has told the Pulaski County school system and Augusta Independent earlier this week, don't use any public resources to take a stance in that campaign.
That's a matter of principle. You're not supposed to be using public resources to campaign on political issues, but it's not really, aside from principle, making much of a difference. If you look, Bill, at what they do when they're told to take down their message, they basically say, well, we had to take down our message against that horrible amendment. So since we can't tell you how horrible that amendment is, we're going to stop. You know, it's pretty cynical.
The entire verbiage of those amendments has to be on the ballot. Does that make it a little more intimidating, and certainly more important that voters read those ahead of time so they don't get in there and face those paragraphs on Election Day?
Well, it's not important that voters read it ahead of time. What's important is that we have voter guides that break down what they're really deciding for them in simple terms, because most voters are not going to read that complex language.
Republicans dominate the Kentucky legislature. They hold supermajorities in both the House and the Senate. Democrats simply did not recruit enough challengers to make much of a dent in that this year. But there are a few interesting races to watch, and it might be argued that the 45th in central Kentucky, Lexington down into Jessamine County, is one to watch. A conservative Republican who defeated a moderate in a primary, and a Democrat who was once a Republican. So that is Republican Thomas Jefferson versus Democrat Adam Moore. Is that one we'll look at on election night?
So, Bill, if you don't mind, I want to push back on the sort of criticism that we've heard in some Democratic quarters against the Kentucky Democratic Party and the candidates they've fielded. When I did my analysis of the districts that now we have people running in, what I see is that the Democrats offered candidates in pretty much every one where their party should have had any chance on paper. True, it's maybe demoralizing they don't have candidates everywhere, but where they don't have candidates are places they were almost certainly going to lose anyway. They've got candidates in the place that matter. In this district in central Kentucky is a good example. On paper, that's a great district for Democrats, one of their best opportunities to pick up a seat, and they've got a strong campaign against a new candidate who's fairly conservative and is going to have a harder time getting those centrist voters who are going to decide who gets that seat. Democrats have a decent chance in that district.
And you make a good point, but if they are to make gains, they have to chip away, right, at these huge supermajorities, and clearly they're not in a position to do much of that this year.
Well, they're not at all likely to wind up with a Democratic majority, but you do have to be patient, and you start with the parts of the battlefield where you might be able to pick up some victories. You start looking at the hard cases later on when you have more seats and you can devote some of your resources to long shots.
So, in other words, they're best served to go in the urban areas, it would sound like.
And suburban areas where voters have been moving leftward.
All right. What do you make of these local option medical marijuana votes? Because some voters will go in and face that on the ballot, and others won't see it.
Yeah, we already have a patchwork system when it comes to alcohol and alcohol regulation. So now we're folding another level of what you can and can't do in localities based on medical marijuana now. It's a confusing situation. I'm not sure it's the best kind of situation you want to have, but at the end of the day, at least we get democracy. At least people can decide what their community's roles will be.
Dr. Voss, what will you be watching over the next few weeks?
Well, people always worry about an October surprise, something that's going to upset that apple cart. Sometimes the campaigns deliver the October surprise, but the world's a pretty topsy-turvy place right now. We've got the Middle East as a possible threat. We've got strikes around the country.
That we just learned a bit ago as we're taping this Thursday night, by the way. I think that's being put off until January, so on that the port strikes. So anyway, yeah.
Well, and the Democrats needed to put that away. This is not the first time they've been threatened with a strike they were able to keep under wraps to prevent it from having electoral damage.
Lots to watch. Thanks so much for coming by. We appreciate it very much.
Thank you.
Everybody stay with us in just a moment. We'll tell you about an effort to help those people who are in such dire straits after Hurricane Helene's remnants rolled through. We're coming back on Kentucky Newsmakers in a moment. Welcome back to WKYT's Kentucky Newsmakers. Once again, natural disaster grabs our attention. This time it is the death and devastation left behind by the remnants of Hurricane Helene. Kentucky had some damage, but to our south and east it is catastrophic. In places like North Carolina, East Tennessee, and Virginia, the images and the stories are heartbreaking. Unfortunately, many in eastern Kentucky understand all too well what they're going through. And now Appalachian Regional Healthcare, or ARH, sees an opportunity to pay it forward and help people in need. Joining us is ARH's CEO, Hollie, the first woman to ever lead that important healthcare organization. Thanks for coming. We appreciate you being here, Hollie.
Thank you, Bill.
ARH is Lexington-based, but most of your clinical operations are in eastern Kentucky and Appalachia. So you know firsthand what people went through in 2022 and what you went through and your employees in 2022. Did that inspire you in this situation?
Most definitely. What we lived through 2 years ago in eastern Kentucky truly impacted my life and left a lifelong impression on the devastation that I saw, the lives that were lost. And when it happened in eastern Kentucky 2 years ago, my immediate reaction was we had to step up and do something. Our mission in ARH is to improve the health and well-being of the communities that we serve. And we do that truly in partnership with our community. So, what we've seen the past couple days in the mountains of Tennessee and North Carolina just hits home once again, because it brings back all the memories of what I saw firsthand happen in our local communities in eastern Kentucky.
So people are struggling. What are they dealing with right now?
People honestly right now are dealing with the shock of losing absolutely everything. I remember in those initial days talking to some of our employees who had lost everything, and it was truly like what you would see in somebody who was experiencing true shock and trauma. And I don't think people probably have even realized the scope and breadth of the loss that they are facing. Just to wake up and your home is gone, a lot of times for people, their loved ones are gone, their pets are gone. And to try to, rise above that takes a lot of resilience.
Yeah. And there's something about the human spirit that wants to help in this situation. And you're seeing that already.
Oh, most definitely. We started collecting supplies to help the hurricane victims a couple days ago, and the people that have shown up at our office with truckloads of items already, telling us stories of how they were impacted in eastern Kentucky and wanted to give back. It's just been so touching to talk to people over the past couple days about what they experienced and how they're stepping up to give back.
What are the kinds of items that are needed?
Bill, I tell everyone, look around your home and all those basic daily necessities that we take for granted are what everyone needs right now. I remember in the early days of the eastern Kentucky floods, everyone needed cleaning items. People are trying to start to clean out the mud and the water and the mold. So any type of cleaning supplies is really needed. We're hearing a lot of need for Benadryl and Zysol, any type of antihistamines. I guess there's been a big problem in the mountains of North Carolina and Tennessee with yellow jackets and bees coming out of their natural habitat and being very aggressive with people. And then food, water, the basic necessities of life.
Yeah. No clothing as of right now.
We're not taking clothing right now, maybe in the future, but right now we're just trying to focus on those basic needs.
How do you plan to get the supplies to people in need? I know obviously it was within your footprint when it happened in eastern Kentucky.
Yes.
This time you'll have to have some cooperation. Right?
Yes, it takes a lot of coordination.
Yeah.
We learned a lot about logistics when we stood up our flooding operation, and for the past 2 years we have been running a distribution center in Hazard in the old JCPenney building, helping people in eastern Kentucky rebuild, and we've transitioned that operation from food and water to now we're helping people with appliances and vanities and home supplies. So we're blessed to still have that facility in Hazard. So our current plan is we're going to move all of our supplies that we collect here in Lexington and across our hospitals to our distribution center in Hazard. Then we're partnering with the community college and some trucking operations to get the supplies down to the mountain communities in North Carolina and Tennessee. We've had some initial discussions with Samaritan's Purse and the work that they are doing in the region. So it really takes a lot of partners to make this happen.
What are your employees telling you about their enthusiasm really to do this drive.
Oh, they're so excited, Bill. I was at Our Lady of the Way in Martin a few days ago, and when I got there, our CEO was telling me about the fact that our nurses up on the second floor had already started talking about that they wanted to gather supplies. This was before we even announced what we were doing as a system. So our employees are always ready to give back to their communities and to see them give back to our brothers and sisters in these other Appalachian mountain communities. It's just wonderful.
Okay, so again on the drive, people can drop off the supplies at any ARH hospital and your headquarters here?
Yes, any ARH hospital. We've got bins set up in our lobbies, as well as we've got a tent and bin set up in our parking lot here at 2260 Executive Drive. Here in Lexington, we are taking supplies every day from 8 to 5 until next Friday. We may extend it past that, but we're going to wait and see, but that's the date we've set for now.
Hollie, tell us about ARH for those who see the initials, and obviously we see the commercials and know your commitment to that region. But tell us the importance of that healthcare system.
Bill, our system is almost 70 years old. We go way back and have a very rich history in the mountains of eastern Kentucky and West Virginia. We are a nonprofit integrated healthcare delivery system. We currently have 14 hospitals, 95 plus clinics, home health, DME. We have a cancer center. We operate a couple of medical malls, a few medical spas as well. So we are really an integrated system that stretches a big geographic territory from the South Market in Middlesboro, Kentucky, all the way to Hinton, West Virginia.
And your hospitals are in an area with a lot of health struggles. A lot of folks, have a lot of issues. Are you hopeful about Appalachia becoming healthier in the future? I know part of your mission is to educate people, right?
It is, Bill. One of the things that we are truly focusing on now is the wellness portion of healthcare, and introducing people to healthcare while they're still healthy and well. So when they become sick, we're going to be there always to take care of the sick people in the communities that we serve. But focusing on addressing the social determinants of health, diabetes, smoking, obesity, all of those social conditions, we feel we can really make an impact on people's lives. And one of the things we're really excited to be working on is the Food is Medicine initiative to help us in that wellness and preventive care space.
That's in partnership with the Department of Agriculture?
It is. Jonathan Schell and I are the current state co-chairs for the Food is Medicine initiative, along with the Kentucky Hospital Association. And our vision for that initiative is to truly work with our local farmers to get fresh produce and fresh protein into our hospitals, and then equip our patients when they leave our hospitals with food boxes and the tools that they need to keep up their nutrition at home and to get back on a healthy path in life.
If people want more information about that, they can visit, I guess, your website or the Department of Agriculture?
Yes, the Department of Agriculture has a space about that. We do as well.
We know there are significant workforce issues in healthcare, and that has to occupy a lot of your effort, right, just to recruit employees.
Yes.
And retain good employees. How much of a challenge is that?
It's definitely a challenge. It's one that keeps me up at night. I will say it seems to have gotten a little bit better than what we experienced during COVID with a lot of the travel nurses that we had all across our country. We've been able to recruit a lot of our nurses back home, and that's been a wonderful situation for us. But I worry, Bill, about all areas of our workforce. We have a ton of IT jobs that are available for people now, and we're trying to partner with local schools, community colleges, universities to introduce our young people not only to the clinical jobs in healthcare, but the business jobs, the IT jobs, the service jobs that we have. I mean, it takes a massive team of people to run a healthcare operation.
Do you think there are many young folks who do not realize the opportunities that are available within healthcare?
I do. I think there's a lot of people that think about, oh, there's just doctors and nurses, and don't realize everything else that it takes to truly make a healthcare system work. We have jobs now in cybersecurity, artificial intelligence. These are things that our youth need to be informed about.
All right. Well, again, let's talk about the drive. Let's put that info up if we can one more time about this Help Hurricane Helene Victims in partnership with ARH. And you can drop off supplies between 8 and 5 p.m. at any of their hospitals or at their location here in Lexington, which is off Winchester Road.
Yes, 2260 Executive Drive.
All right. Really appreciate you coming in, Holly.
Thank you, Bill. It's always good to see you, and congratulations on your 40 years of service with WKYT.
I appreciate that. Stay with us, everybody. We'll wrap up Kentucky Newsmakers in just a moment. Before we go, we do want to remind you that Kentucky Newsmakers is available on demand at WKYT.com and on our WKYT News app, and also is a podcast. If you'd like to listen to the audio, you can do that weekly as well. But we appreciate you being with us here for this edition of Kentucky Newsmakers. We hope you'll be with us next week, and we certainly hope you make it a good week ahead.